inspired. We've all got things to do.
Order. I call this meeting to order. This is the Standing Committee on Health. I'm Johnny McDonald, the MLA for Hants East and the committee chair. Today we'll hear from the Office of Healthcare Professional Recruitment, Nova Scotia Health, Doctors Nova Scotia, Nova Scotia Paramedics Union, and the Nova Scotia Nurses Union regarding impact of the labor shortage on the healthcare system. Just a reminder, put all your phones on silent. I'll now ask each committee member to introduce themselves by stating their name and constituency. And this time I'll start with MLA Boudreau.
Hi, Trevor Boudreau, MLA for Richmond.
Good morning, everyone. Chris Palmer, MLA for Kings West.
Good morning, folks. I'm John White, MLA for Glace Bay Dominion.
Good morning, Nolan Young, MLA for Shelburne.
Good morning, Susan LeBlanc, MLA for Dartmouth North.
Hi, Gary Bro, Halifax, Chebucto.
Good morning and welcome. Rafa Di Costanzo, the MLA for Clayton Park West.
Good morning. Kelly Regan, MLA for Bedford Basin.
And for the purpose of Hansard, I'll recognize the presence of Chief Legislation Counsel Gordon Hebb to my left and Legislation Committee Clerk Judy Kavanaugh to my right. Yes, MLA LeBlanc.
Thank you. I'm sorry to interrupt your introductions, but before we begin, I have a quick motion to make, please.
Okay, so has the motion been sent to the clerk?
Yes.
Is there a motion?
Shall I distribute it?
So it hasn't been distributed yet, so I guess we'll get it distributed right now. If you could please send that along. If it's okay with you, can I do the introductions of them while that email and people are able to read? Thank you. Okay, so I'm going to welcome the witnesses, and I'm going to have you introduce just your name and your position and how you'd like to be referred to. Going from, I'll start with Deputy Minister Beaton.
Good morning, Craig Beaton, Associate Deputy Minister with Department of Health and the Office of Healthcare Professional Recruitment.
Good morning.
Mr. Beaton, again, thank you.
Oh.
No, it's you. They need to put the mic back on. Apologize.
Good. Good morning, Dr. Annette Elliott Rose. I am Chief Nurse Executive and Vice President, Clinical Performance and Professional Practice at Nova Scotia Health.
Good morning, I'm Dr. Leisha Hawker. I'm a family physician and past president of Doctors Nova Scotia.
Good morning, I'm Kevin MacMullin. I'm the business manager for the Paramedics of Nova Scotia, represented by IUOE Local 727.
Good morning, Janet Hazelton, President of the Nova Scotia Nurses Union.
Okay, thank you. Now we'll get back to the motion. So, MLA LeBlanc.
Yes, thank you very much. Including all of our honored guests today, we also have in the audience, as it were, members of the NSGEU, including President Sandra Mullen. NSGEU represents 14,000 members throughout the healthcare system. And so I'd like to make a motion that this committee amend our witness list for today's meeting so that we can add NSGEU and Ms. Mullen to the witness list so that we're able to hear from the representatives on behalf of the NSGEU members in the province.
Okay, hold on one second. I'm going to ask, is there any debate? Okay, so I'm just going to ask a question of the clerk. Oh, MLA Palmer.
Mr. Chair, if we could just take a minute. We just received the motion, so I heard the member, but if we could just read through the motion, take a minute to read through the motion.
Yeah, that's fine. Just a minute.
Okay.
MLA Palmer.
Thank you, Chair. I appreciate the motion put forward by the member, and it's important that Nova Scotians have an opportunity to hear from all voices, as many as we can get on different topics. Just, I guess, a reminder to the committee and to those present that at the agenda-setting meeting for this particular committee, this meeting this morning, when the topic was selected, the witnesses were presented, and unfortunately NSGEU was not included in that list. In preparation for meetings, it's always important that all parties have an opportunity to prepare as witnesses when they come before us, to prepare for questioning and hopefully have insight into what can be said. So I'm going to maybe put another motion, or how do we proceed on that, Mr. Chair?
Well, depending on what you would be asking, if the intent of what you were about to move would be to nullify theirs, I'd have to call that out of order. You'd have to vote against their motion.
Okay.
So if that was your intent, then the motion, I'd call it out of order, and I'd just say if voting nay does what you were going to do, that's how you'd have to deal with it. Any other discussion? MLA Burrow.
Just to speak to Mr. Palmer's point, since that agenda setting has been done, the NSGEU has released a number of important figures at the tail end of January, which speak very directly to the subject that's before us, so that it really would seem missing an awfully important opportunity to discuss this subject of shortages in healthcare without having the advantage of that research and the union that is the author of it.
Thank you. And MLA Young.
Thank you, Mr. Chair. Just with respect to the process of this, you know, when we do agenda setting, we select witnesses and stuff for the meetings, and I just think that it's not a good precedent to set to have at any time witnesses come that we would add them to the meeting. I mean, through the agenda setting process is typically where we have discussions and find the witnesses that are selected amongst the group. So I just find this highly unusual.
Thank you. Oh, get this right. MLA Di Costanzo.
Thank you, Chair, and we would like to support the motion of our colleagues from the NDP.
Good. MLA LeBlanc, did I see your hand up? So, MLA LeBlanc.
Well, I know how this is going to probably end up, Mr. Chair, but I will say that even though something is highly unusual does not necessarily mean it's not a good idea. And so my colleague, Mr. Burrell, has explained the reasoning why we've brought this to the table this morning, and I urge the government to support the motion so that we can get as much information on this very important topic as we can, but I'll leave it there.
Thank you. Any other? MLA White.
Thank you, Chair. This was a Liberal topic, as I recall. Did the Liberals not think through to come up with their witnesses? We suggested, all witnesses you suggested, we've accepted to this topic. That's my recollection of it. I don't think it's fair that NSGU is missed. I really don't. I think they have a lot to add to the topic, but I don't think it's fair that we're to be sitting here and trying to think of what question I'm going to ask them now. I don't know about you folks, but there's weeks of research that goes in this, not months. I do not want to have a witness sitting here that I don't have questions prepared for, because that's even a bigger insult to have a witness sitting there and not have questions for them. Thank you, Chair.
MLA Regan.
Thank you, Mr. Chair. We are now eating into the time that we would be using to question our witnesses. I suggest that we vote now. We can pretty much see how this is going to go.
Yeah, so as soon as I'm sure everybody's on debate, MLA Regan, same as when you're in chair. So thank you. Any others? Okay, all in favor say aye. Oh, I only needed one. Okay, recorded vote, but that's fine. The clerk will do a recorded vote. Clerk, please.
Mr. Boudreau?
No.
Mr. Palmer?
No.
MLA White?
No.
MLA Young?
No.
MLA Regan?
Yes.
MLA Di Costanzo?
Yes.
MLA Burrell?
Yes.
MLA LeBlanc?
Yes.
MLA McDonald?
Oh, sorry. No, I forgot to turn my own on. So the motion has defeated. The motion has defeated. Any other? Okay, so we'll start with opening comments. I believe Deputy Minister Beaton will be first. Deputy Minister.
Good morning, everyone, and thanks for the opportunity to join you here today. There's no question we're in a challenging situation when it comes to our health workforce in the province. Nova Scotia isn't alone in this. We are seeing the same play out across Canada and around the world. The demands on our health system continue to grow. It is true that we have seen unprecedented growth, but it's not just more people. It's more people with more complex needs, whether that's due to age or chronic illness or something else. We need more healthcare workers across the system. Doctors, nurses, paramedics, CCAs, pharmacists, lab techs, dietitians, respiratory therapists, psychologists, and many more. We know there are vacancies in our system, and we know that those vacancies are having an impact on the healthcare system and on Nova Scotia. That is why workforce development is such a priority. It's so important to our work to transform the system that it is, in fact, Solution 1 in Action for Health. As a government, we play an important role, but we are not alone in doing this work. We are working with our health system partners, including Annette and her team at Nova Scotia Health. We're working with our labor organizations, including the other witnesses here today, working with colleges, regulators, and professional associations, with other levels of government, with other provincial departments, with our post-secondary sector, with private sector, which is where you'll find paramedics, pharmacists, and psychologists, and many others, and with communities. We're doing a ton of work to recruit and retain healthcare workers all over the province. It's a big table, but it's one that has done some pretty incredible work over the last few years. That work falls into 4 main categories: training and education, recruitment, retention, and system redesign. I'll start with training and education. We've added more seats in the healthcare programs, which means training more doctors, nurses, CCAs, and paramedics, and more. We're creating brand new programs to help meet the challenging needs of our population, our workforce, and our health system in roles like physician assistants and emergency medical responders, to name a few. These roles didn't exist in our health system 2 years ago. And today, we're not just recruiting to fill those roles, but we're actually training people to do them and making sure that there is a clear pathway from our post-secondary schools to our healthcare system. The second category of work is recruitment. We are looking outside of Canada to fill crucial healthcare roles. We just got back from a recruitment mission in Australia where we made hundreds of connections with healthcare workers of all kinds. Those connections are already working for us. We've already had 16 paramedics accept job offers to come to Nova Scotia, and the team is still matching candidates to jobs. And because of the work to streamline licensing with a number of countries, including Australia, once they arrive in the province, they can get to work even faster. The third bucket is retention. This is so important because it's much easier to keep someone than to replace them. Communities play a significant role in this, which is why we created the Office of Healthcare Professional Recruitment Community Fund. In the last 2 years, we've invested over $3 million in community-led retention and recruitment initiatives. We've negotiated new contracts for doctors, nurses, and paramedics. And we're using retention incentives and return of service agreements to get people back in our public healthcare system. And we're doing our part to ensure healthcare workers are able to do what they can do best, which is deliver healthcare services. That means expanding scopes of practice, creating collaborative care teams where everyone works together, and getting rid of much non-healthcare work as we can, like the 250,000 hours of red tape cut for physicians so far, which is all part of our work to transform the system, which is the fourth category, system redesign. Investing in new infrastructure, adopting new technologies, testing new approaches, all with one goal in mind, connecting more Nova Scotians to care. This is complex work for sure, and none of these things happen in isolation. We need to make sure that the pieces fit together, that our training programs prepare students for the realities of the job, that we are recruiting from places with similar licensing requirements, that we understand how changes in one part of the system have an impact somewhere else so that we can plan for that. The view from 20,000 feet is important, but equally important is the view from right here on the ground. Because at the end of the day, we are talking about people, their livelihoods, their families, and Nova Scotians who rely on them every day. The changes we're facing today have been many years in the making. We are focused on many exciting things happening in this space, and I look forward to answering your questions. Thank you.
Thank you, Mr. Beaton. Does Dr. Elliott Rose have? Okay. Dr. Elliott Rose.
Good morning, and thank you. In addition to introducing myself, I wanted to also add that I'm a registered nurse. I've been a registered nurse for about 24 years. I've had the good pleasure of working in primary care and emergency care and perinatal care, and as well as in educating our new nurses, and most recently, of course, in leadership. So thank you for having me here today. Everyone working in health, those caring for Nova Scotians, and those making care happen for Nova Scotians are the heart of our healthcare system, and we need more of them right now, today. And that's why Nova Scotia Health is here at the table with government and with partners to work on solutions together. While I've seen a lot of change during my 24 years as a registered nurse, it's not until recently that I've seen a commitment to coordinated response and change with all system partners. So it's good to be here with all of you today. Healthcare needs change and progress and transformation to provide the care Nova Scotians need now and into the future. Do we have vacancies at Nova Scotia Health? Yes, of course we do. And are we doing everything we can to fill them as quickly as possible? Yes, of course we are, and there's much more to do. We are adding new people at this time, all the time, and focused on keeping the talented people we have. Since September 2021, we've seen a net gain of 204 physicians and almost 900 nurses. Our overall turnover rate, so the rate of people leaving Nova Scotia Health, is well below the target of less than 1% and has held steady for more than 2 years. This means that for the most part, people are staying and working in healthcare in Nova Scotia. We continue to fill vacancies by bringing on new grads and recruiting people from Nova Scotia to return home, by welcoming internationally educated health workers, and by recruiting retirees to return to work and share their expertise and mentorship with the next generation. We continue to prevent vacancies by keeping people working in healthcare with incentives, by supporting them to work to full and expanded scope, by focusing on wellness and recognition, creating flexibility in scheduling and ways of working, and continuing to work with system partners to respond to challenges and advance innovation. We are focused on fostering inclusion and diversity and equitable workplaces, and by supporting the provincial health equity framework. We continue to recruit and retain talent by redesigning how services happen. And we're using the best available evidence, technology, ensuring people have the space, supplies, and equipment they need to do the good care that they're doing to meet the needs of Nova Scotians, and doing that in a sensible, efficient way. All this is making a difference in care. And I'm looking forward to sharing some specific initiatives that are happening on the ground to make this transformation happen. And there's more to do. So we also keep listening to Nova Scotians when they talk about their experiences at Nova Scotia Health, listening to those working in health and our partners when they bring forward issues and ideas and innovation, and listening to our employees when they tell us, hey, we have a problem here, we need to work on some things. We acknowledge that challenges persist, and we continue to address the challenges head on. We have many good things underway, and I look forward to sharing some of those with you today, and I look forward to hearing from partners as well. Thank you.
Thank you. Dr. Hawker, do you have opening?
Yes.
Dr. Hawker.
Good morning, and thank you. It's my pleasure to speak to you today. I'm Dr. Leisha Hawker. I'm past president of Doctors Nova Scotia. I've been a family physician in Halifax for about a decade. In my first few years of practice, I actually split my time between Nova Scotia and locuming in the Northwest Territories, providing acute emergency services and primary care services in remote flying communities. I'm very lucky to practice at the North End Community Health Centre along many allied health professionals. I'm one of the founding physicians of the Newcomer Clinic, which serves refugees in Nova Scotia. And most recently, I work 1 week a month at the Recovery Support Centre in Dartmouth, providing outpatient withdrawal management. I've also recently been appointed as the Chief Medical Officer for Hockey Nova Scotia, and I'm one of the physician leads of One Patient, One Record. I know, I have too many jokes. My colleague, Dr. Colin O'Dane, the current president, you'll notice he's not here today, and although he would have loved to have been here today to speak to you, he would have had to cancel an OR to be able to be here today. And so I'm your replacement today, and although he's in the OR, it's due to the exact challenge of labor shortages that he's not able to be here today. So it's important that we begin today's discussion by acknowledging that physician stress and burnout really is at an all-time high, while physician wellness is at an all-time low. I believe this is equally the case for most of our other healthcare providers as well, including our nursing, paramedic, and other allied healthcare provider colleagues. It should come as no surprise that Nova Scotia's healthcare system is under significant strain, and the aging health human resources and aging patient populations is a part of that problem. Nova Scotia also struggles with long wait lists for services in many areas. As a result of the primary care shortage, our province has many people without a family doctor. As of March 1st, almost 16% of Nova Scotians and over 156,000 people are on the need a family practice list. Just as patients have aged, so too have our physicians. Almost a quarter of our physicians are 60 years and older and looking at retirement in the next few years. Despite the fact that the health authorities are working hard to recruit physicians, on March 4th, there were 213 physician vacancies posted online, and 129 of them were in family medicine. In response, the Nova Scotia government has undertaken some innovative solutions to fill the service gaps, such as mobile clinics and incentives for after-hour surgical services. While appreciated, these measures are stopgap measures until our province is able to recruit more physicians. It's why Doctors Nova Scotia believes we must also focus on making our province a place where physicians want to practice, so we keep those currently working here as long as they wish to and in a sustainable way. While Doctors Nova Scotia is not involved in service delivery, we've been using our influence in ways that will support physician recruitment and retention. One of our key goals is stabilizing primary care so that Nova Scotians have their own family doctor. The 2023 physician contracts focus both on incentives to support our current complement of family physicians and initiatives to attract new physicians to the province. Over the next 4 years, all physicians in Nova Scotia will benefit from improved compensation with an across-the-board increase of 10% spread out over the life of that contract. In addition, some specific measures were put in place to stabilize primary care and reduce pressure on emergency departments, such as the introduction of the new longitudinal family medicine payment model. This new model provides stable and equitable funding for family physicians who provide longitudinal office-based family medicine, with a particular focus on improving access and attachment. New fee codes were created for some of the invisible unpaid work that family doctors do. So these services can be both measured and remunerated appropriately, such as complex patient visits, new patient intake visits, patient-specific consults, and telephone prescription renewals. We also have been supporting mentorship and practice support so that physicians are supported to practice in their province. And we've been working with our government colleagues to reduce unnecessary physician administrative burden to improve their work-life balance. Nova Scotia has been leading the way in this work. We are making strides to stabilize the system, and there's important work still to be done. Together, we must continue to ensure meaningful improvements are made that will lead to better access to primary and specialty care for all Nova Scotians and a vibrant and healthy work environment for Nova Scotia's physicians, which is essential to recruiting and retaining much-needed physicians in Nova Scotia. Thank you.
Thank you. Mr. MacMullin.
Thank you. Chair John A. MacDonald, MLAs, witnesses, members of the public. Good morning, everyone, and thank you for the invitation to participate in today's discussion regarding the impacts of the labor shortage on the healthcare system. As we are all aware, the healthcare system has been in decline for a period of years, and increased demand for service continues to rise due to a number of factors. An aging population, longer lifespans, an increase in our population, onset of new illnesses such as COVID, more retirements combined with decreases in births over the years are all part of the issue. Our lifestyles have changed with each generation, and an explosion of social media has resulted in younger generations being more aware of opportunities and are more mobile and willing to travel for work, combined with exploration of other regions. Many years ago, if you were lucky enough to obtain a job where you grew up, it would be a lifetime career of keeping that job position. That has changed today, whereby our younger workforce is willing to travel for better opportunities and a chance to see other cultures and countries. Plus, today, there are many occupations that are competing for an increase in their workforce to keep pace with demand, making the job market very lucrative for employment opportunities. Healthcare, policing, firefighting, and teaching are experiencing challenges in retaining and recruiting employees, and will face that for the near future as demands for service increase, and we lose employees to retirements and other jobs. The question is, how do we in healthcare compete with the other sectors for these valuable employees and retain our current experienced workforce? That is a complex challenging situation that will require retooling of resources and equipment to meet the demands and expectations of the workforce. New technology, training, and mentorship in the workplace are the benchmarks that healthcare needs to set in order to be competitive. And the workforce has to have an opportunity to be involved in decision-making from the front lines to the boardroom, as well as a path of advancement in their career expectations. Wages and benefits are always part of the solution, but challenging the workforce and bringing forth new ideas and advancements with due recognition will be the answer. No matter what your occupation is, from being a nurse, paramedic, physician, medical technician, and many others in the healthcare environment, they all want to be part of the solution to our current crisis. Let them be heard, encouraged, and rewarded for their contributions to solving issues, and the workforce will be a better place for growth and appreciation. We have to look at how can the workplace be better, more flexible to the demands on service and employees' life/work balance. And notice that I have put life first. Our healthcare workforce has been under tremendous strain these past few years and has taken a toll on the mental and physical health of many workers. Recognition of this has to be in the forefront for the present and future workforce, and we must develop strategies to foster an environment of safety for our workers. Thank you for listening, and I encourage everyone to work on these initiatives.
Thank you. Ms. Hazelton.
Good morning, and thank you to the members of the Standing Committees on Health for the invitation to appear before you to discuss, specifically the work life of nurses in Nova Scotia and the shortage. My name is Janet Hazelton, and I've been the president of the Nova Scotia Nurses Union since 2002. And this May, I will have been a registered nurse for 40 years. And in all those 40 years, I've worked in Nova Scotia as a nurse. We represent 8,000 nurses in this province. Our nurses work in long-term care. They work in VON. They work, of course, in acute care. We represent RNs, LPNs, and NPs. We are the largest occupation within the healthcare system, the nursing profession. We are there 24 hours a day, 7 days a week, and some would say we are the glue that holds the system together. And recently, that glue is not as tight and as secure as we would like it to be. Our healthcare system is currently grappling with over 1,000 vacant nursing positions within Nova Scotia Health alone. So that does not conclude our community, our long-term care, or the IWK. This is reflecting a vacancy rate of 16.5%. The situation exacerbated by our population growth rate that is outpacing the growth of our direct care, our registered nurses. Through the growth in the number of LPNs and NPs employed in direct care may be higher than RNs, it's not enough to meet the surging demand for the healthcare system. The proportion of direct care nurses working in hospital-based and long-term based care is also decreasing, a troubling sign of the working conditions these group faces. Despite Nova Scotia having higher per capita numbers of registered nurses, licensed practical nurses and nurse practitioners than the Canadian average, our system clocked 496,000 overtime hours in our inpatient services in 2021-2022. This overtime is a testament to the dedication of our nurses, but also highlights the unsustainable pressure on our workforce. Significantly, 1 in 5 new nurses in 2022 were internationally educated. Yet, the inflow of nurses from all sources is not keeping pace with the demand, as evidenced by the alarming 75% growth in vacancies for registered nurses and 62% for licensed practical nurses in 2021-2022. The gap between nursing supply and the nursing workforce for RNs at 6% and LPNs at 5% signals the potential for bringing nurses back into the system, provided we offer them compelling reasons for them to return. Further, we need to ensure that the next generation of workforce see nursing as a viable career. We risk further erosion of our enrollment numbers if we do not improve the working conditions that we expect these young men and women to work in. Some of our nurses recently participated in a poll by the Canadian Federation of Nurses Unions that exploring the work life of Canadian nurses. 1 in 5 nurses indicated that they were dissatisfied with their choice of nursing as a career. The top reason given for that dissatisfaction was insufficient staffing, lack of work-life balance, and very high unsustainable workloads. Beyond the professional toll that nursing shortage is exacting, the financial implications are stark. The province has spent a staggering $126 million on private agencies for temporary nurses in acute and long-term care in 2023 to 2024. Our entire collective agreement that we recently negotiated for all nurses in the Nursing Council had a cost of $294 million. So that's the wage increases. All of the increases that were in that collective agreement were $294 million, yet we spent another $126 million on agency nurses. The disparity underscores a fundamental misallocation of resources that should instead be directed towards improving working conditions and benefits for our nurses, rather than enriching private corporations. We must reevaluate our reliance on private agencies, as discussed at a previous Health Committee meetings and included in our newly negotiated collective agreement. The province needs to explore a publicly employed pool of nurses that would operate much the same as agency nurses, with nurses benefiting from flexibility that the role would afford, rather than corporations benefiting financially from the physical and emotional labor of nurses. There is no reason why a nurse from Truro could not go and work in Parsborough or Pugwash if they so choose. Another recently negotiated initiative that we are hopeful will improve retention and recruitment of nurses is our guaranteed minimum number of nurses, a flexible nurse-informed version of nurse-patient ratios. We hope that work towards formalizing that guaranteed minimum will be underway soon. To ensure the efficiency of our nursing workforce, it is crucial to place nurses in settings that maximize their skills and expertise and ensure they are properly resourced. Additionally, focusing on areas of growth, such as nurse practitioners, can significantly address gaps in our primary care coverage. In conclusion, if we are willing to spend millions on nursing care, these funds should be invested in improving the working conditions of our nurses by extension the healthcare services provided to Nova Scotians. This is not merely a financial issue, but a moral imperative to ensure the sustainability and resilience of our healthcare system. We need to ensure that we maximize every dollar spent on the system and invest in the people that keep it functional. Thanks, and I look forward to answering any of your questions.
Thank you. So just a reminder that don't try not to speak until you're recognized. Each caucus gets 20 minutes each to speak and ask questions. At the end of that, I'll divide by 3. I'm expecting we'll be done at 10:45. The first caucus is the Liberal, which will be MLA Regan.
Thank you, Mr. Chair. So my first question is to really to the Office of Recruitment. We've recently received a FOIPOP back that indicates there were already 31 physician departures in the first 6 weeks of this year here in Nova Scotia. So that means we're well beyond halfway to last year's number of 50 departures. Could we get a regional breakdown of where those physician losses were?
ADM Beaton. I'm expecting it to you.
Yeah, thanks very much for the question. I don't have the breakdown of that with me here today, but it's something we can provide back to the committee.
Thank you very much.
MLA Regan.
Thank you, Mr. Chair. So thank you very much. We'll look forward to that. Any idea, whether it's Nova Scotia or ADM Beaton, why are so many physicians leaving in the first 6 weeks of this year?
Who? ADM Beaton?
Sure.
And then
Sure, I'm happy to start. Physicians have multiple reasons for leaving their practice, but I would suggest that I think I wouldn't know the numbers of actual influx. I'd have to look at that as well. We've added a net gain, as Dr. Elliott Rose has said, over the last 2 years has been a net gain of 204 physicians. So while we do have some that leave, I think on the flip side, we've actually retained more, and we brought more in, which is positive. Dr. Hawker had talked a bit about the contract and the new compensation model that we have with longitudinal family medicine. That's been a significant benefit in terms of bringing new physicians on. It's certainly a model that younger physicians are attracted to. It's a bit of a blended model where there's an opportunity to earn fee-for-service based on your service encounters, but there's also a guaranteed salary income, which many new physicians are looking to be able to enter into. So we've seen an increase in physicians actually joining that compensation model. There's been over, I believe it's around 260 of our former alternate payment plan physicians that have entered into the new contract model, and we've seen a number of fee-for-service physicians as well that have moved over to the longitudinal family medicine because it's a good compensation model for the work that they're doing, and also an ability to be able to manage their patients, their roster, and balance their work lives. So I guess to close on that, I don't have the breakdown for the first 6 weeks of what we've done from a recruitment perspective, but I can tell you that even the latest mission that we've had in Australia, which the College of Physicians and Surgeons has participated in, they met over 300 students. They had over 200 practicing physicians. There's a real opportunity there for physicians that are interested in joining. So I think it's been a positive overall net gain of 204 in the last 2 years.
Emily Regan, did you want Dr. Hawken to comment?
Hawker, did you have something to add there?
I also don't have the data on the specific breakdown, but I will say from talking to colleagues that have either left the province or closed their practice, most of the losses are related to retirements and related to our aging physician workforce. But there are also some physicians that I've worked for that have gone home mainly because they came here for residency and we just were unable to retain them. A lot of times they're early career physicians and they're just returning home to their home province for further supports around starting a family. Although saying that, the current contract that was negotiated over the summer has really strong parental leave supports, and there's a lot of talk about that amongst physicians across Canada, and also the longitudinal family medicine payment model. At the North End Community Health Centre, we've had 2 physicians retire over the last few years, and they had quite large practices. So it's been a real struggle for us to, we haven't kind of had anyone leave the practice. We're trying to absorb them the best we can amongst our physicians and nurse practitioners that we have, but it's been a real struggle. And in the next week or 2, we actually have a physician from Australia coming to tour our practice. So I have my fingers crossed for that.
Thank you. MLA Regan.
Thank you, Dr. Hawker. I really didn't hear an answer from Mr. Beaton about why physicians are leaving, so your insight was most helpful. I will just note that when we do have physicians coming in, they are not taking the vast numbers of patients that we saw in the past with doctors. And we also have an increase in population. So now we have 156,000 people on the doctor wait list, which is more than doubled since this government took office, vowing to fix the healthcare system. So I just want to make those particular points, because I do think that where there are some successes, we have to do more faster to recruit more doctors, because quite clear, or nurse practitioners, because quite frankly, we are seeing people falling through the cracks. And all of us as MLAs, when we have constituents reaching out to us, they are not getting what they need from, it's good to have the one-offs where you can go into a clinic and have your strep throat dealt with, but people need to be followed by a nurse practitioner or a family physician. And just simply saying, well, people are going to retire. This needs to improve, and it's not improving fast enough. Do we know how many physicians are projected to stop practicing this year?
ADM Beaton.
So again, it's a complex question in terms of how many are set to retire. We don't actually have a set number, because really it's an individual physician choice about when they wrap up their practice. We have added additional supports and to provide support to those that are looking to stay in practice longer. I've referenced the longitudinal family medicine contract. We do know that there are some that have indicated that new compensation model is going to enable them to be able to practice longer. We have a physician hotline that the team has been working diligently over the last number of years, and I believe since last May, while there has been additions to the needed family practice list, that hotline actually reduces the number that go on there by supporting physicians, and there's been over 30,000 people that have been mitigated from entering onto that list because of the supports that have been provided, whether that's providing a billing clerk or providing a nurse supports within the clinic to be able to support the physicians. I would just say, it is complex in terms of being able to support primary care and attachment. And while there has been increases in physician demand, particularly from the perspective of you've outlined that newer physicians are not taking on the same numbers of people as previous practicing physicians, which is why one of the reasons that we've looked at the system redesign as a key pillar in that, and looking at how we add additional appointments. So I know that people have heard this number before, but I think I would just reiterate, like 60,000 new appointments into the healthcare system is a significant number per month. When you capitalize and you add that up, that's 720 appointments per year. Which is providing access to patients. And really it's the focus that we're trying to get is make sure that patients actually have access to care, whether that's through whatever primary provider best suits them at the right time, the right place. And it alleviates pressure on the physician workforce as well by doing that, by adding additional supports, which is really the concept that we're driving towards collaborative care and the idea of having health homes and health neighborhoods that support an individual, not necessarily just one single provider.
Thank you. MLA Regan.
Thank you. Over to NSNU and NSH, how much has been spent on travel nurses this past fiscal year? And where are we spending the most on travel nurses? Is it in ERs, rural ERs, long-term care?
Dr. Elliott Rose. Oh, Dr. Elliott Rose, please. Thank you.
And thank you for the question. So as of the end of the calendar year, approximately $78 million at Nova Scotia Health on travel nurses. And that varies, the areas where travel nurses are working. So in specialty areas, so where we need in critical care and emergency services, and in rural areas as well. There are a number of travel nurses working there.
Emily Regan, who was the other person I forgot?
Ms. Hazelton.
Oh, sorry, Ms. Hazelton.
Yeah, she would know the numbers better than I in Nova Scotia Health, but we also have a significant number in long-term care, which is a huge concern for the nurses union, because often those individuals, the residents in long-term care, often have dementia, And there is a language barrier that's real, which is very concerning for our residents. They get confused. Now they have permanent bracelets on because the agents, I don't call them travel nurses, it sounds too glamorous. The agency nurses don't know the residents. You know, they're in, they're out, so they don't develop a relationship. It's not like the home it used to be where everyone, you know, the CCAs, the licensed staff all knew the residents. It's very concerning, the prevalence of them in our long-term care. At least in our acute care systems, there is other nurses there to support them. There's other nurses to help them. That's not the case in long-term care. So, you know, we're very, very concerned. There is no agency nurses at the IWK. They've never, ever had any. And VON, our community nursing, does not have. So it's mostly the health authority and long-term care facilities.
MLA Regan with just over 9 minutes left.
Thank you. To the Paramedics Union, can you provide the number of paramedics that have both exited and entered the profession in the past year?
Mr. MacMullin.
Thank you, Kelly, for the question. That's difficult to entertain because some of the people that have left in the past year have also come back as a casual paramedic. Because sometimes work-life balance, as I said before, is difficult when you're on a schedule. And your schedule requires you sometimes to work excessive hours because there's shift overruns, long delays at hospitals due to, delays for offload of patients, the traveling that paramedics do in the run of a shift can sometimes run into about 700 to 800 kilometers a shift, which is a lot of travel. And that weighs on people. They leave the system and maybe come back on a part-time basis, come back on a casual basis. So it's kind of difficult to narrow down the exact numbers.
MLA Regan.
If you have the opportunity to, when you go back to the office, to take a look and see if you can give us some numbers, that would be most helpful. Thank you very much.
Mr. MacMullin.
Sorry about that.
Don't worry.
Yeah, Kelly, we can do that. We can get some better numbers for you right off the top. And that, over the past number of years, though, we have lost a significant number of paramedics due to the fact of retirements, the wage gaps that wages were much higher in other jurisdictions, and as a result, people felt the need to leave Nova Scotia to travel to other provinces, much like travel nurses and that. And yeah, it did weigh heavily on us. But we've now opened up a couple of new schools too, and that to supplement this. And with the new recent contract that we've negotiated with the employer and with the province, we have significant better wage increases. We have better benefits now for our paramedics, and we've seen an uptake in the last couple of months of paramedics who were off on disability coming back to work. Others that were on a casual basis are now willing to come back to work on a full-time basis, and some people have indicated that they are going to return to the workforce from away.
Emily Regan, just so you're aware, ADM Beaton might have a comment to it.
I'm good.
Okay. Emily Regan.
My final question before I pass it over to my colleague. We're hearing from constituents who are being taken off the doctor's list. They get a new doctor. The doctor leaves in a year, and they're back on the list. And this is happening to people repeatedly. And I'm just wondering, Dr. Hawker, could you provide any insight into why that kind of thing is happening, where we have doctors coming here and they're practicing for a year?
Dr. Hawker.
Thank you for the question. And in terms of the data around that, I think Dr. Rose might be able to speak to that a little bit better, because she did mention that we are retaining more than we are losing in our recruitment efforts from outside of Canada. I do know one physician who I worked with at the Regency Park practice, who he probably was here around 1 year before closing his practice, and unfortunately he had taken on about 2,000, I think, patients rather quickly. And so I think some of it speaks to the need to provide more mentorship and support for onboarding physicians, especially physicians that are international medical graduates. And so we're working quite closely with international medical graduates now with a mentorship program with Doctors Nova Scotia to really help make sure that they have the supports that they need so that they are successful and staying in that practice. Luckily, that physician that did leave Regency Park, we have started practice with a new physician, Dr. Jaswinder Singh, is practicing there now. And so some of my patients at my addictions clinic, who I was very happy when they finally got a family doctor and then quickly lost a family doctor, luckily in that scenario, they have a new family doctor again. But we just need to really focus on supporting those, especially internationally trained physicians, so that they really set down roots and have a long practice and career here.
MLA DiCostanzo.
Thank you. And how long do I have, Chair? And how long do I have?
Just over 4 minutes.
4 minutes, perfect. My question is to the Office of Recruitment. When the government decided to axe the HRM family doctor incentive, and I've been very outspoken about this, it really angers me as to watch what happened when I was first elected in 2017. I remember thinking, I hear of other areas that they're short on doctors. I had very little, maybe one email or two a month. I went from that to maybe 10 a week. The incentive made a huge difference to doctors in Halifax. Come and see the walk-in clinics and the lineups in my riding. It's sad. It's sad what this incentive did, and I just would like to know, and we know that in HRM the wait list went from 18,000 to 77,000. That's 400 to 500% increase. So it was very obvious, and it just boils my blood, and now we hear that it's been reinstated. So is this an admission that incentives shouldn't have been cut? And who made that decision? If somebody could answer me on that, please.
ADM Beaton.
So the incentive, we consistently look at how incentives work to make sure that there's movement within the province. The previous decision was around trying to ensure that we were having mobility into the rural part of the province, which was really difficult to try to get physicians to set up shop in rural parts of the province. And they incentivized that by putting an incentive. We didn't have at that time, as I understand, difficulty retaining physicians into the central zone, except for the rural parts of the central zone, which were still included in that previous incentive. So if you were in a rural part of HRM, you could still qualify for that. Reinstituting the new incentive, as you mentioned, was announced just, I think, last week or the week before. And we're happy to have that incentive put in place. As you know, there's been significant population growth. The majority of that has been in HRM. We know from the Need a Family Practice Registry that over 30% of the people that are on there are actually new to the province, many of whom are residing in HRM. So therefore, looking at what other jurisdictions are doing as part of our analysis, neighboring cities like Moncton and Fredericton, they had incentives. So, when we're reviewing the analysis, we felt that it was time to at least put a recommendation forward, and of which government supported, to put the incentive back in for the central zone.
MLA DiCostanzo.
I'm sorry, I just find it really difficult how Halifax was punished, truly punished, for having enough doctors to going to 5 times the numbers without attached doctors. It was a terrible decision, honestly and truly, and as you said it's a lot of immigrants. I would love to know how many of the new immigrants are on the unattached. We're setting up, our schools are overpopulated. They're coming to this country and have nothing set up for them. And here, and you knew that. You knew immigrants came and settled in Halifax, or the majority of them, 90%. And we take away something that was of a benefit to them, a benefit to everybody, not just to them. But I feel Halifax was punished, and I'm really upset. And I see what is happening in my riding, and it makes me sad. And we just opened a Bayers Lake Outpatient Center. Zero new patients can be taken there. There is a clinic, a family doctor or a primary clinic with 0 patients for my riding or any of the Halifax West riding. Why was that? And how you had 2 years or 3 years to prepare for that. Not one doctor was hired there. Then they move a clinic from Parkland, they call the Kearney Lake Clinic, with full capacity of patients. They don't take one new patient, and moved it and put it in Bayers Lake Outpatient Center to show that
Order.
it was filled. Sorry.
The Liberal time has stopped. It will be the NDP, MLA LeBlanc.
Thank you very much, Mr. Chair. I just wanted to go to the travel nursing agency. Sorry, travel is quite glamorous, as you say. So there are other provinces that have been exploring this idea of like an internal provincial agency, not agency in this case, travel nursing, locum nursing program. You've mentioned it here. I know that other provinces are thinking about it. What would it take to get that to happen here?
Ms. Hazelton, I expect that's who you're asking the question to, Emma.
Yes.
LeBlanc. Thank you. Ms. Hazelton.
We've had several conversations. All it's going to take is a conversation, literally. Manitoba recently initiated the program within Manitoba. They have 400 nurses from Manitoba have applied to be agents. No, they won't be. They'll be employees of the health authority within Manitoba, but they'll be dispersed throughout Manitoba. They're going to make a larger salary, but that's because they won't be making what an agency nurse makes. Newfoundland has it in Labrador only, but they're now expanding it to the rest of the province. So it's very, very doable. All it's going to take is for the unions and the employers to sit down in terms of this, which we have discussed. It's not that anyone is saying, no, we're not interested. It's just that we have to get to it.
Emily LeBlanc.
Well, here we are at this table. We've got the employer, we've got the nurses. May I suggest that possibly to the employer that we get to it? Because $126 million on private nurses, and I think the amount that you said for NSH alone was 76 million. Is that right? 70-something million. Is a lot of money. And you know, it doesn't make any sense. I know that we will be continuing to ask questions about this to the minister and estimates, but you know, let's get it done. I want to also talk about, so even if we had that program, we still have some retention issues and we have some recruiting issues, I would say, based on what we've heard today. So I want to ask about the retention bonus. And I think I want to ask both the Ms. Hazelton and the employers, the NSH. I get the idea of the retention bonus, and I think that, you know, anyone who has it or has received it has definitely deserved it. But it seems to me from the many pieces of correspondence I have received that there has been a sort of dividing and conquering with this bonus. People are working on the same floor, in the same units, in the same clinics. Some people are getting an extra 10 grand and some aren't. And it's for like these seemingly arbitrary reasons. So I just got an email the other day from a woman, so in 2023 was working for NSH, but working casual. So now they're working permanent for NSH. They are willing to sign a 2-year agreement. They're not allowed to get the $10,000 bonus. And so they're literally working across across a bed from somebody who's making $10,000 more for exactly the same thing. These kinds of arbitrary, and maybe they're not arbitrary, so I'd like to hear about it, but it seems to me that there needs to be a rethink on this, because what's happening is, some people are super angry and not feeling at all thanked, or not feeling at all that Nova Scotia wants them to stay in the province to work, and then other people do. So I guess Dr. Elliott Rose, can you explain that to me and tell me what I'd like you to say, actually, is that you're rethinking it and that more people are going to get that retention bonus.
Dr. Elliott Rose.
Yeah, thank you for the question and the comments. I would say that we look at every individual and have a conversation and assess their situation based on the parameters of the retention bonus. It is a system-wide bonus, so Nova Scotia Health is an employer, part of the system. There are other nurses across the system involved in that, and we work in partnership with the Office of Healthcare Professional Recruitment and others to say, you know, what are the parameters that make sense. But I would encourage anyone who has reached out to you to send information to us, and we will work through that with them. I can't say that we'll change the specific parameters of the retention bonus, but there's a commitment to work through individual cases.
MLA LeBlanc.
Thank you, and I would love to hear Ms. Hazelton's thoughts on the $10,000 bonus.
Ms. Hazelton.
Unfortunately, we weren't party to whatever the parameters are around. I'm getting the same emails you're getting with a lot of people that are very dissatisfied about. My understanding is if you didn't receive it the first time, you can't receive it the second. That is my understanding. But we did not participate in negotiating. Like, we will be participating in the negotiation of the 2 years return of service because they are our members, and but we didn't, the parameters had nothing to do with any of the unions, not just NSNU.
MLA LeBlanc.
Thank you. So continuing on with nursing, we know that we are doing a lot of recruiting of international nurses or international nurses, I guess, or students. Anyway, people are coming in, they're doing a training. I guess that's the licensing training, the 10-month training, or the 10-month recertification. Someone can clarify that. Anyway, they're getting paid, they're getting it, then they're going to go into the workforce. Great idea. But then there are local people who have trained in Nova Scotia or in Canada who want to upgrade, want to go from being an LPN to an RN, those kinds of transitions, who are struggling because they need to pay their own education and they need to work while they're doing it. Is anyone looking at people who want to further their education, going from an LPN to an RN, doing that in a way that's sustainable so that they can continue working, or that they can take some time off to do the education, but also get paid for it, or continue working, but anyway, the education part, the tuition being covered by the province?
Okay, Dr. Elliott Rose.
Thank you. So I can speak to Nova Scotia Health. We do have a number of bridging programs that you're speaking about for LPN to RN, RN to NP, and there are a number of different funding opportunities. Not fully funding necessarily. Some of it is where people will have funding while they're away doing school. Some of it is bursary focused. So happy to share those details from Nova Scotia Health. I don't know if you want me to comment on internationally educated nurses as well.
MLA LeBlanc.
That's okay. Thank you. I will just be very clear and say that I have no problem with making sure that internationally educated nurses coming in are getting paid to do their that is great. But I'm saying do it for everybody because, listen, we should just have free tuition in Nova Scotia in general. So that would cover off all of these issues. I want to ask about the health homes. Mr. Beaton, you and the minister and everyone is talking about health homes. I've been talking about health homes for many, many years. I love the idea of health homes. That being said, we hear a lot about them every time we ask about what's happening with, access to family care, and yet we're not seeing any new health homes opening. So last year in the budget, Dartmouth North, the area that I represent, there was a pseudo announcement, but anyway, it seemed like there was money in the budget and it seems like things are going forward, but it's taking a long time. And as we hear about 60,000 new appointments opening on virtual care or pharmacies or whatever, we still do need this overarching attachment place, even if it's not with a doctor, but a place that someone can go for their care. only makes sense. So what is the holdup? Are we spending all kinds of, like, you know, I'm hearing a lot of, you know, great things about the 60,000 plus appointments, but then, and I hear a lot of great things about the health homes, but then I'm not seeing actually anything changing. And yeah, so can you please speak to that? What is the timeline? What is the plan? When are we going to have people on that doctor's wait list attached to health homes?
ADM Beaton.
Thanks very much for the question. So health homes has been talked about nationally, obviously, and the Canadian Medical Association has been talking about health homes. It's certainly one of the key drivers for primary care that we're looking at here in the province. The attachment piece, so I don't have the number off the top of my head, but again, like we can get this in terms of the strengthening, but the focus this year has really been around strengthening health homes and providing additional supports to not only the primary care provider, whether it's the physician, but adding additional components within that, whether it's a social worker, whether it's a family practice nurse, whether it's an LPN, and we've seen success in a number of those areas. I know the Dow Clinic has been mentioned many times before. I think the number is around 45 strengthened collaborative family practice teams that we've been moving forward with this year. But it's even broader than that in terms of like looking at health homes and then this concept of health neighborhoods in terms of like how do we bring in the support that the pharmacy is providing. They may not actually be in the same building, but also but providing care to that community as an example. And so there's a number of work underway there in terms of like interoperability around health records, you know, the exchanging of patient information, that type of thing. It's fairly complex in terms of making sure the patient is at the center of all of that care. So I don't have a timeline other than the fact that it's a clear focus for the work that we're doing in terms of adding people in. The new contract we negotiated with Doctors Nova Scotia, there's a new program there for allied healthcare professionals, actually, where if you're a physician and you're not part of a collaborative care team, you can actually apply. There's a pot of money there. If you want to bring in somebody to support your practice that will therefore support your patients, whether it's a nurse or a dietitian or some other allied health professional, there's an opportunity. So there's a pilot underway now with Doctors Nova Scotia that goes even beyond that. So maybe not necessarily a health home, but moving towards that collaborative model.
MLA LeBlanc with about 8 minutes left.
So I just want to be clear that you do not have timelines on standing up health homes in Nova Scotia and getting people from the 150,000 people that are on the needed family practice wait list, getting them connected to a health home. You do not have timelines for that.
ADM Beaton.
Well, I think there's context there. I'm not saying that we have a definitive timeline. We're going to stand up X amount of collaborative family practice teams. What I'm saying is that it's ongoing work as part of our primary care strategy that we're moving towards trying to develop as many collaborative care and health homes as we can. There's individual work that's done in each of those health homes or health neighborhoods that NSH would work with a number of those groups to establish them. And of course, the central zone, western zone, the primary care directors would have a number of areas that they're working on. I don't have those timelines of which would be for those specific sites, but what I'm saying is that it's a clear focus that it's ongoing work.
MLA LeBlanc.
Great. I mean, listen, I'm not trying to be combative at all. I started this by saying that I think this is where we need to be in Nova Scotia. But I have to say that the people who have been waiting for primary care, who end up getting their primary care from a doctor with a text message in Calgary, or standing in line for 3 hours at a walk-in clinic, or going to a mobile clinic and hoping to God that they're going to get there in time, it's not good enough. And for a government that's been elected to fix healthcare to not be able to say by the next election, this is going to be what we've done, or this is where we want to be, and then you can vote to tell us if you think we did a good job or not. I find it unreal, actually. And I just, like, it's it's not good enough. I know that everyone is working so hard, but it feels like to the people who aren't attached or don't have, when someone feels sick, that they make a choice not to contact not to try to get an appointment because they know they're going to be waiting for hours and hours and hours or whatever. Oh, we'll just see how I feel tomorrow. Like it's not a good state. Anyway, I'm sorry, I'm getting a little flustered. So back to Ms. Hazelton. We've heard that the shortages in nursing are resulting in nurses working more hours with less support. Can you talk a little bit about what it looks like in practice for your members? What are you hearing from your members about what that's like because of the nursing shortages?
Ms. Hazelton.
I think for the first time, and I've been doing this job since 2002, so for the first time I'm hearing the words burnout. Like, I've never heard nurses describe themselves as burnt out. We have more nurses that are admitting that they're struggling with burnout, they're struggling with mental health. You know, you need time off. You need to be with your families and your loved ones. And many, many are not getting that. A lot of our younger nurses don't get vacation. They just don't. And they can't. There's no ability to replace them. That's not sustainable. And young people today, thank heavens, have options and they have choices. And they're not going to be like older nurses that work every shift God sends them just because they want to help out. Our newer, younger generation are saying, I need this for my mental health, and they're taking it. So I'm very concerned. I think there's a lot of effort going in, for sure, but things have to happen quicker. To your point about any LPN that wants to become an RN, I agree, fully financed. They should be just fully financed. If they say they want it, all they have to do is guarantee to be an RN in this province, because we have more RN vacancies than LPN vacancies. And if they express an interest, it should just happen. It's not happening. So we need to do something, because nurses are leaving. For the first time ever, we've had vacant seats in our universities for enrollment. That has never happened. Normally there's 300, 400, 500 people on a wait list to get into nursing. That says to me that the appeal of being a nurse is disappearing, and that's because they're hearing what's going on and they're saying, I want no part of this.
Emily LeBlanc with just over 3 minutes.
Want to go? Okay. Just quickly, I'm wondering if someone from NSH or the department can talk about how many beds might be closed right now in hospitals across the province because of nursing shortages. Are there any beds closed right now, or wings closed because of nursing shortages?
Dr. Elliott Rose? You nodded, so I just assumed.
And thank you. I don't have that data with me, but I don't think there are any beds closed. In fact, I think it's the opposite. We are actually over capacity in many units, right? And the beds are filled. And people are waiting for beds. So we have a number of wonderful people working in healthcare to support the services for Nova Scotians, and it's actually that we have folks who need beds in different units, and so things are busy. Yep.
Emily LeBlanc, 2 minutes.
Great. So, sorry. Mr. MacMullin, last year's Auditor General report on ground ambulance services made clear that we're losing paramedics faster than we're training new ones, and there's now about 200 vacant positions for fully trained paramedics. What is the deal on the ground right now for your members? How is this impacting their day-to-day?
Mr. MacMullin.
Their day-to-day routine is very stressful. They realize that the call volume has increased over the past number of years. A decrease in our employment levels have resulted in less trucks being available. And when there's less trucks available, that means there's a backup in the system. And being tied up in offload delay, sometimes at regional ERs, causes our members to have to work harder that aren't in offload delay, because now they have to respond to greater distances for calls. They have to cover off in other areas. We've been working with the employer and with the government in trying to offset that. We've been introducing a new SPEAR unit, which is a single paramedic unit that can attend to low acuity calls. And that paramedic unit can go in and do an assessment on a low acuity call and make a decision in conjunction with our communication center, with the physician, the community paramedic, and the nurse that are all in the communication center on pathways for that patient, which may include transport to an ER or maybe a follow-up visit with their physician. And so that's taken a little bit off of it. But still, we are understaffed. That is hard because of the great losses we've had over the last number of years.
Sorry, I should have reminded that. I apologize when I have to say order. The 20 minutes are up. The PC Caucus, MLA Palmer.
Thank you, Chair. Thank you again for all for being here. It's definitely a great conversation. We need to have this conversation. We're discussing some of the challenges. I think we're also getting a chance to hear some of the initiatives and some of the opportunities that are out there for our province. Obviously, Nova Scotia is not isolated as a jurisdiction facing a lot of these issues. So I think what I'd like to ask the Associate Deputy Beaton, because we're facing a competitive market for recruitment and retention, for healthcare professionals, not just doctors and nurses, that's been a focus, a lot of the conversation, but many healthcare professionals, whether they be lab techs, diagnostic imaging. Could you please, Associate Deputy Beaton, talk about how Nova Scotia is trying to stand out in its recruitment and retention opportunities, and the messaging and incentives and strategy that you're trying to put out there to make Nova Scotia stand out in this competitive market we're in?
ADM Beaton.
Thanks very much for the question. It's no doubt that we're competing not only nationally but globally for health human resources. I will say that we have fantastic teams of recruiters, both within the employers, NSH, Seniors in Long-Term Care, through the work with the Health Association Nova Scotia, as well as some of our private providers. And we try our best to do a coordinated approach to marketing and recruiting. We have a significant brand that's recognized internationally that's called More Than Medicine. We utilize that. But predominantly, one of the main things is we promote the province, and we promote the quality of the work-life balance where possible. We know that there's challenges in the workplace, but we do offer incentives and a number of other things to be able to attract folks to the province. It's a tough decision when you're trying to recruit people, not only nationally but internationally. And I've had this conversation with colleagues and with others, and somebody had said to me one day, it's some people will hem and haw about getting a gym membership for a couple of months, and yet we're asking people to make quick decisions to travel across the globe and set up shop in a new part of the country or a new part of the world. It's a significant decision, so we've tried to put as many resources. There's a lot of time and energy spent with individual candidates. We have immigration consultants that work with them to help streamline, and we work with our regulators around streamlined pathways. So there's a number of levers that are being invested in to try and coordinate the best recruitment experience for candidates as possible.
MLA Palmer.
Thank you. And you had mentioned, I think I might have taken this right, from a trip you went to Australia, the 16 new paramedics will be coming to Nova Scotia from that trip alone, or did I understand that correctly?
ADM Beaton.
That is correct. Yeah. Did you want? Okay.
MLA Palmer.
I'm not sure if it was the Associate Deputy or Dr. Elliott Rose. Someone mentioned in their opening comments the importance of long-term workforce planning. I think I heard that there. And I'm not sure if this has really been addressed a lot in Nova Scotia up to now. Could you please expand on what that means for outcomes and explain the benefits of long-term workforce planning?
ADM Beaton or Dr. which? Oh, ADM Beaton, I guess.
Sure, I'm happy to start, and fortunately we have an expert here beside me on health workforce planning. Dr. Elliott Rose has spent a considerable amount of her career on that, so I'm happy to pass it over to her. But System-level planning obviously is extremely important in terms of understanding the needs of the workforce, the future forecast. I have some, we're lucky to have some incredibly smart and bright people, a few of them that are sitting behind me here today, that work in this space in terms of looking at what the forecasted need is going to be going forward. Not only from population projections, but also from service delivery. I think the difference, because employers have done workforce planning for years, the difference as part of what we're trying to do in terms of transforming the system is trying to look at that as a whole of system approach. And looking at how when you make a change in one area, what the impacts will be. So an example of that would be pharmacy. So, pharmacy, it's been widely talked about the expanded scope of practice, what that means. It actually means more work for the pharmacist. So in able to be able to plan for that and looking at the 20,000-foot view, how do you backfill some of that support? Well, that work obviously is needing to be done in pharmacies across the province. So that work then falls to pharmacy techs and pharmacy assistants. And we work with the college and the association as well as employers about building bridging programs to try and enhance and look at international recruitment opportunities to bring in techs as well as assistants, and then career pathway advancements as well as part of their overall path for career development. So I don't know if Dr. Elliott Rose wants to add more to that, but
Dr. Elliott Rose.
Thank you. Thanks for the opportunity to share some of the work around long-term workforce planning. So in Nova Scotia, we've agreed that we are going to focus on a model called integrated needs-based planning. So that means we understand with the data that we have to the best of our abilities, the health needs of Nova Scotians, and then we plan our people and our services based on that. So once we understand the services and the best evidence and level of support that Nova Scotians need, then we can look at the skills and competencies of the people working in health and build our service models accordingly. So as ADM Beaton shared, what we haven't done in Nova Scotia is actually optimized and maximized the scope of people working in our system. So people are educated a particular way, but there's been a gap between how they're educated and how they work. And so we're starting to close that gap significantly in Nova Scotia. When we look at the workforce gap, so who we have and the talent we have and the people we need and the talent we need, there are lots of levers that we pull and different interventions that we have. And everyone here today actually mentioned those, and ADM Beaton referenced them as well. So recruiting and educating more people, retention, many aspects to retention, happy to share some of the things underway, but also in development. And then redesign. We need a more efficient system. We need technology to help us. People need supplies and equipment and spaces. And so you need to do all of those things in a prioritized, coordinated way to close that gap in the workforce, and it has to have a cumulative effect. So that's why you're hearing about all the good things today and more to come, because all of those things are required to close that gap in the workforce.
Emily Palmer.
Thank you. One last question for Associate Deputy Beaton. Nova Scotia was acknowledged by the CFIB recently for the creation of the Atlantic Physician Registry. And could you please talk just briefly about how the registry and other initiatives to reduce barriers for licensure are making a difference in attracting healthcare professionals to Nova Scotia?
ADM Beaton.
Sure, thanks. I think I can talk about the registry first and then maybe a quick statement around the streamlining pathways. But so the registry really is about increasing labor mobility of physicians across Atlantic Canada. You would have heard Dr. Hawker talk about her time as a locum up north, and that is one of the benefits of the registry. Actually, is that there are many physicians that like to provide support into rural or remote communities for a variety of reasons. This registry has enabled mobility within the Atlantic provinces for things like locum coverage, which certainly enables quick supports and levers to be able to have physicians brought in quickly when they're licensed across 4 provinces. So there is a licensing fee of $500 with the registry, and once that's done, it's maintained across. So previously, if you wanted to practice in New Brunswick and do a locum, you would have had to take out a licensing fee for that, but you couldn't practice in Newfoundland. So it does increase the ability for labor mobility across. It's been fairly effective. I think it's around 140 some have registered on the registry so far within Atlantic Canada. And in terms of streamlining pathways, obviously, if you're looking at jurisdictions that you want to recruit people from, if you're working there and you understand that, you know, the ability to get into the workplace is going to be quicker from a licensing perspective, that's going to be a more sought-after destination. So working with colleges and regulators around streamlining pathways has been extremely effective in opening doors for attracting people from other countries.
MLA Palmer.
Thank you. I'll pass it on to my colleague, MLA White.
MLA White, with just over 10 minutes.
I'm going to continue with the same two witnesses because they're kind of in the same line. But I just want to leave with this. Governing is planned. It is methodical in nature. I would say, unlike knee-jerk reactions we see from the opposition members, quite often, by the way, our government is moving forward with a purpose. And when you speak about what's going on, resources such as Cape Breton University, you know, we're talking about burnout. We're talking about things that haven't been done for a long time. We're playing a lot of catch-up here. And the rural communities, underserved areas, have been dealing with this since years before it came to the city, to be honest with you. So CBU shows a perfect example of how we're planning for a growing population in the future. When I think of the Science Discovery Centre, I think of the ability to do research in rural Nova Scotia. That is a big issue with attracting doctors, I can only imagine. I think about the medical school and all that's going to offer. I believe we're going to have a Michelangelo there, the robot. So I'm just wondering if you can speak a little bit of partnership with our post-secondary institutions and how these seats will help create sustainable health professional numbers in the future.
MLA White, is that to ADM or Dr. Elliott Rose?
Both.
Okay. ADM Beaton.
Yeah, sure. Well, I think we're extremely fortunate to have the amount of post-secondary institutions that we have in the province to be able to partner with, not only universities, but also the NSCC, and there's also private career colleges. So I think one of the biggest benefits, and I know there's been a lot of focus around retention, recruitment, but also retention. Training, as Dr. Elliott Rose has talked about, is a significant component of that. So when we look at planning for the system and what the future needs are going to be, recruitment of individuals, whether it's internationally or domestically, is not going to be the only lever that's going to be able to support the growth that we're going to need in the health system. We're going to need to see things like increased training capacity. And, you know, I think, you know, one indication would be there's been over 400 nursing seats that have been added to the system. We've doubled our capacity for medical imaging and radiology technology. We've seen, you know, not only CBU open up a new opportunity for a medical campus there with additional of 30 seats, but there's also a bachelor social work program, and all of those pieces are going to be key elements to be able to provide the right provider for the right patient at the right time. So having these institutions working collaboratively, whether it's through our Department of Advanced Education, who hosts academic partnership tables that we participate in, all looking at how we can support the forecasted future demand of the workforce is extremely important. I don't know if Dr. Elliott Rose wants to add any more to that, but.
Dr. Elliott Rose.
Thank you. Well, I think it's important to share maybe a blush of some successes. And ADM Beaton and I were talking this morning about, we were actually forgetting some of the things that have happened because things have happened so quickly. So I'll just read off a few important successes, I would say, around education and training. So we opened the 21-seat nursing program in Acadia, and then a recent announcement around a new build at Acadia to support that program, and it'll be expanding as well. 180 practical nursing seats at NSCC, the 24-seat physician assistant master's program at Dalhousie, full, started in January. We're going to see output from that in 2 years, and that's a fabulous success. Looking at expanded program at Dalhousie for 12 additional seats for X-ray technology, 13 for respiratory therapy, and 8 new seats for ultrasound, a number of new residency seats for PhD psychologists, We talked about paramedic training earlier, free tuition books and other programs related to CCAs, and now we have a condensed program for CCAs, and there are more. Like, we have a long list of fabulous partnership with our education colleagues to advance this very quickly. We know that the output is going to take a few years to really see the full success of that, but that's really transforming the system at an accelerated rate.
MLA White with just over 5 minutes.
Thank you. I heard you talk about we do so fast, we move so fast. That's one of the things we hear. Hurry up, but slow down. Hurry up, but slow down. You can't do both. And it's been neglected for a long, long time. So I think about my region, Glace Bay. Glace Bay Emergency Department was last opened in 2019 for 4 days. It's now open 3 days a week. And I hear how people appreciate that so much. And not just that it's open, of course they want it open longer, but they know it's open. It's open Monday, Tuesday, Wednesday, every week. We know that, and we can depend on that. So that matters. I think about the medical school. I think that's going to offer 10,000 appointments, I believe it is, something to that effect. But more importantly, 30 doctors, graduating 30 doctors a year. What is that going to do to help us provide to address the critical shortage in rural communities?
MLA White, and that is two. Who wants? Okay, I guess ADM Beaton.
Well, I think anytime you're going to add additional capacity, it's going to have a significant impact on the ability to attach additional patients. So, adding additional 30 seats and 10 more residency seats for internationally educated physicians as well at Dalhousie will have a significant impact. Right now, our retention rates of our residents is hovering around 75, might be 80%, which is pretty effective considering that not every resident that goes to Dalhousie will be from Nova Scotia. So we try to retain as many as possible. With Cape Breton University, the difference there is that we have return of service agreements associated with that school. So those new 30 physicians will be guaranteed to practice in a rural part of Nova Scotia for 5 years following their graduation. And that will have a real impact on service delivery in rural parts of the province, which is going to be a significant benefit for patients that are needing care.
MLA White with 3 minutes left.
3 minutes. So I understand we're going to graduate 30 doctors a year, and they're mandated to 5 years service. So basically that's 150 doctors in the system before any can consider even leaving. Is that correct? And if it is, then can you tell us what that's going to do? What does 150 doctors in rural Nova Scotia do? What's that like?
Emily White, are you asking ADM Beaton or are you asking Dr. Elliott Rose?
Whichever has an answer for me. I just want to know the impact, how much
Beaton.
impact that's going to be.
Yeah, you're challenging me on my math, but I think you're right on 150 by the time they, when the last ones leave and end their return of service and the first ones begin in terms of practice. I think it'll have a significant impact, but also, there will be an opportunity for, physicians that are in those rural communities to be able to see the opportunity for them to maybe also exit their practice. So, we've negotiated with the Doctors of Nova Scotia a new program called Transition In, Transition Out, which supports them in terms of a new physician coming in and taking over a practice, because it can be pretty daunting. So, having these new physicians come in and then train potentially with a rural provider who then sees the light of the day of being able to transition, they care about their patients and they want to make sure they have continuity of care. So I think the continuity of care in certain parts of the province with the potential to expand hopefully will be the desired outcome.
MLA White with 1.5 minutes.
MLA Nolan Young is on the go.
MLA Nolan.
Emily Nolan.
Yeah, I'll be quick with
Oh, sorry, MLA Young.
With 1.5 minutes, it's all good. What is the department doing to recruit healthcare workers into the rural communities?
And that is to ADM Beaton.
Yeah, thanks. I think I've sort of what I've outlined before. Really, we have a number of recruitment strategies for rural Nova Scotia, particularly with when it talks about physicians, we have the incentive programs. But one of the other key pieces that I wouldn't want to miss on saying is the community fund, in terms of communities play a significant role in recruitment. And you know, I don't want to understate that $3 million of community-led initiatives with a number of providers that we work with. There's an annual conference for community groups that do recruitment and retention. This year it's happening in Truro. And you know, what we've heard from them is they really value the support because they're the ones that can tailor what is needed within those specific communities. So we've had some great initiatives, you know, whether it's supporting not only the incoming healthcare provider, but also their families. So that, like, those are beyond just the individual recruitment of the provider, whether it's a physician, a nurse, et cetera. There's a number of areas that the community fund supports in terms of retention and getting those newcomers involved in their communities.
May Young with 7 seconds.
Thank you.
Okay, so the next round will be for, as soon as this thing wants to reset for me, will be for 3 minutes each. MLA Di Costanzo.
Thank you, Chair, and I would have loved to go back to my, to give time to Mr. Beaton to answer my first question. Hopefully I have, but I have two important questions to Janet Hazelton, if I may. The first one is regarding nurse practitioners. We know how valuable they are. Can you tell us more about where are they in the province? Are they being used to their capacity? Are we training enough of them? I heard Ms. Elliott, in her successes, I didn't hear nurse practitioners as part of her successes in education. So where are they practicing, and how can we recruit more? What do you think is happening? I know that my family doctor begged for one 3 years ago when there were 3 doctors, and they were told they can't have a nurse practitioner because they need to be at least 5 doctors. Now we're down to 1 doctor, and they never got the nurse practitioner. If you can talk about that policy as well. Thank you.
Ms. Hazelton.
So the nurse practitioner education is probably one of our biggest success stories, because now we have a program that was negotiated that, you know, a registered nurse in Inverness can apply to become a nurse practitioner, get into the DAL program, and then they are paid their full salary and benefits while they're educated to become a nurse practitioner, sign a return of service in Inverness. We know that that's successful because if they've already practiced in Inverness, so they often will have a family and a home, and so they're not as likely as just to go do the return of service and get out of Dodge. They're committed to that community. They're members of that community. So I think that has been a very valuable program. The growth of nurse practitioners is unreal. You know, what they can do, like the 5 physicians is not a thing. They don't have to have 5 physicians in an office in order to work as a nurse practitioner in an office. That's not a thing. It may have, but it's not. Nurse practitioners are independent practitioners that are able to consult now with specialists. They're able to write any prescriptions. They're able to do predominantly what a GP can do. Not all, but a lot of. So we need to utilize them more, though. We need them in the community. We need them in long-term care facilities. We don't need residents in long-term care facilities to get an ambulance, go to some emerge department at 90 years old to get a prescription for a bladder infection. That we need nurse practitioners that go, because their primary, when they go into long-term care, they often lose their primary care practitioner, whomever that is. We do have some in long-term care, but not enough.
The time for the Liberals. MLA Burrow with 3 minutes.
Thank you. I wanted to ask you, Mr. Beaton, I'm thinking about this this data that the NSGEU brought out about 6 weeks ago really shone a light on the number of healthcare shortages that have to do with other than doctors and nurses, with all those highly skilled healthcare people. And I think they documented 12 areas. So we don't have time to talk about all 12, but I do want to ask about medical radiation technology. Recently, the Association of those technologists has spoken about how burnout in the profession could be really addressed if the government would do a couple of things. One, finance the additional training for MRI technologists, and two, see that training for the profession was available in the region. So I wonder if these things are being addressed, and if you could say a few things about it.
ADM Beaton.
Thanks very much. In terms of the training in the region, we certainly would be working and looking. Part of what I talked about earlier is around some of the forecasting that we're doing and how we would present that to our academic health partners, of which whom we would want to work with to advance on opportunities to create those educational seats. So, we are working with advanced education. We presented data to the Deputy Minister yesterday, actually, on these topics, which would include medical radiation technology. So, work is certainly underway, considering what the opportunities for advanced training would be in those areas.
MLA Burrow.
I wanted to ask you, Mr. MacMullin, just a question about the paramedic assistance initiative. From the point of view of your union, is this initiative the best way to address the shortage?
Mr. MacMullin, with about a minute.
I think you're talking about the EMR program. Yeah. It's a supplement program that hopefully will lead them into the paramedic profession. And that right now we currently have the best paramedics perhaps in the world in Nova Scotia that do a variety of skills. We're expanding all the time. We're into community paramedicine. We do extended care paramedics. We have single response paramedics in SUVs. Our practice is unlimited now with our paramedics. They do a lot of calls every day, and in those calls they are helping the communities, whether it be in nursing homes, whether it be in their homes on emergencies, whatever. But we're very fortunate, the skilled workers we have, and we will continue on with that.
MLA Burrow with 6 seconds.
Thank you very much.
I expect it's MLA Young? No, MLA Boudreau.
Oh, thank you, Mr. Chair, and it's a pleasure to be here. I'm not normally a participant in Health Committee. Former chair, I never got to sit and ask questions. I actually was directing people, and so this is really my first opportunity to kind of speak at Health Committee. And as a healthcare professional who's been in practice for 15 years, and my wife similarly, who's a pharmacist and has been practicing for 15 years here in the province, we have a perspective as well in terms of healthcare and how it's run and how it's been run for many years in the province. My wife and I both, took our schooling in Ontario. I was a locum chiropractor for a year and a half while I waited for her so we could move back to Nova Scotia. And so we were like other practitioners who maybe train here and move away after they're finished. And our job and our goal is to attract and retain them. And I think, there's initiatives for students here in Nova Scotia for that purpose. That's what we're working on. But coming home, it was interesting. So when I was in Ontario, I had the ability to take my own x-rays, read my own x-rays, had access in Ontario to getting x-rays. When I moved home to rural Nova Scotia, one of the first things I did was met with the hospitals, the doctors, the physicians, the nurses in the community, and talked about my skill set and what I could do. And convinced the local health authority at the time to get x-ray privileges. I was the only chiropractor in rural Nova Scotia to have that. Negotiated it myself. When the NDP government was in power at that time, one of the things they did was they said we're cutting 3% across healthcare. And I get a letter from the health authority at the time saying, you're no longer able to write prescriptions for x-rays. And I said, this doesn't make sense. How is this saving money in the healthcare system? Now they have to go to their physician, get a request, go to the x-ray department, get the x-ray, go back to their physician, get the report, then come back to me. And I was told that's not our worry. MSI is a different silo. We don't care about that. This government has changed that. So this government recently announced physiotherapists are going to be able to order x-rays. Chiropractors are able to order x-rays. This is a government who is looking at solutions. We're looking at opportunities to provide whether it's nurse practitioners with bigger scope, my wife who's a pharmacist with larger scope, chiropractors being able to take pressure off that system. So we're all working together on this, and I think this is kudos to the departments who are looking at things outside the box in terms of trying to support people and patients and residents here in Nova Scotia. You know, I want to talk a little bit about the
order.
Maybe next time.
Yeah, you'll have to ask to fill in next time. So that's the end of the questions. So what we'll do is we'll, if anybody has closing statements, and I'll start to my right and go left. Ms. Hazelton.
So the only thing that I have to say is we really need to talk about what's happening in our healthcare system. We need to make this a nonpartisan issue, honestly. We need to, everyone needs, because at some point everyone's going to need health care in this province. At some point everyone's going to need to go to a merge department and not wait 10 hours. They're going to have primary care physicians or nurse practitioners to look after them. This is a Nova Scotia problem. This is not anything but that. So we all need to work together to attract people. Nova Scotia is a beautiful place to live. We all love it or we wouldn't be here. But we need to make the healthcare professionals want to come, live, and work here. It's very, very important. One of the things we have to look at is violence in our workplaces. It's unacceptable. We need to stop it. We have lockdowns now in hospitals. That's ridiculous. People getting into our hospitals with weapons. That's ridiculous. We need to look at that. Some nurses are scared to go to work in emerge departments because they're scared that something bad could happen, not with patients, but with people that could attack them. We need to look at these issues. We need to take them seriously. I'm tired of talking to this about these shortages, about these work-life balances. I'm getting tired of it. Every time I get hope, it gets dashed. We need to stop talking about it and start doing it. We have a collective agreement with lots of initiatives in it. We just need to get behind those initiatives and make sure we take them over the line. Thank you.
Thank you. Mr. MacMullin.
Thank you very much. Yes, we are in a healthcare crisis. We've been in that for several years now due to lack of planning over a number of years, and that by all kinds of governments that we've had in power. And that, but as my colleague has said, we have to collectively, as a group here today and going forward, work on how are we going to solve this healthcare crisis. It will get better. It's going to take time, but you know, it means that we all have to work together in one unison in order to solve the problem. It's going to take collaboration from your unions, from your employers, and from government in order to make this a success. And we need to hear from our frontline workers, the people who are out there every day experiencing the violent scenes that Janet has talked about. We see it all the time in paramedicine, where members are arriving on a home where they've had an extended wait for paramedics to arrive. Now they're angry. They're taking that frustration out on our paramedics verbally and sometimes physically, and that has to stop. The federal government is bringing in legislation in the healthcare industry to stop that, but we also have to do that in the province of Nova Scotia. And we also have to work together, like I said. We have to listen to the frontline people who are out there on the front lines who are experiencing this and take into consideration their ideas, because they're there, they know what's going on, and they can provide solutions. Thank you.
Thank you. Dr. Hawker.
Thank you again for the opportunity to participate today. We are making strides towards stabilizing primary care and improving access to acute care in our province, but we need to build on that momentum, and it will take considerable time to see results, of course. It's vital that all healthcare providers continue to work together to improve access to care, to focus on retention and recruitment of physicians, patient attachment to family physicians, and to build a positive and healthy work environment for all healthcare providers. We need to ensure our province remains a desired location for talented physicians, and Doctors Nova Scotia remains committed to working with our partners to address the challenges facing our healthcare system so that all Nova Scotians have access to the care they need when and where they need it. Thank you.
Thank you. Dr. Elliott Rose.
Thank you for the invitation today and the opportunity to share some of the ongoing work at Nova Scotia Health. We know there's more to do, and I echo everyone's comments that we need to do that together. And we need to build communities and workplaces where people feel like they can do the work that they were educated to do and do it well. We want people to build their health careers in Nova Scotia, build their lives in Nova Scotia. And we are committed to supporting everyone working in health and providing care to Nova Scotians, everyone working in health who support that care for Nova Scotians, so that they stay here with us long term. So thank you.
Thank you. ADM Beaton.
Yeah, thanks very much. Transforming the healthcare system is still a significant, well, it's the #1 priority we have in our department, and we're committed to that. And we understand that people want to see results quicker. The front lines dedication is incredible, and the work that they're doing it cannot be understated in terms of advancing patient care. But there's also other folks working behind the front lines that are doing everything they can to advance transformation as quick as possible so that people do see those results. And it would be remiss if I didn't outline that those people are working incredibly hard in support of the health system. So thank you to them. But I also want to thank my colleagues here at the table, many of whom have participated not only in contract negotiations but also working groups. And I think Mr. MacMullin had said it, like collectively we're better trying to advance these solutions together, and we've seen success doing that with our colleagues across the table here. And I'd like to thank the committee for the opportunity to present today. So thank you.
Thank you. All the witnesses are excused. We have a little bit of business, and there's only 9 minutes left, so we'll deal with the business and let them head out. Thank you very much. So for the correspondence, we have February 23rd, 2024, an email from Nova Scotia Health in response to a request for additional information made from the February 13th meeting, following up on a reply for a request from December 12th meeting on ER closures and doctor retention. Is there any discussion? Nope. Okay. We also received a letter from the Deputy Minister of Seniors and Long-Term Care in response to 2 requests for information made at the February 13th meeting on long-term care builds, impact, and approach. Any discussion on that? Nope. Sorry, Ledge TV for that. March 13th, 2024, the letter from Sandra Mullins, President of NSGU, regarding the witness list for today's meeting. MLA LeBlanc.
Thank you, Mr. Chair. Yeah, well, I just wanted to, point out that this is why I made the motion this morning at the beginning of the meeting, because, Ms. Mullen rightly points out that they should have been at the table. So I just wanted to make that point, and hopefully we'll see them next time.
MLA Regan. Just a sec. MLA Regan. There you go.
Thank you. Thank you. Did I see a motion go around about this particular letter that we would write a response back? Did I see that?
I believe we received one. I'm going to check to see if they're still so.
Okay, because I do have a response to that.
Okay. I'm guessing MLA Palmer.
Now, this side of the table, we withdraw the motion.
So you're not going to put it on the table?
So
okay.
We're not going to put that motion on the table. So
go ahead.
If I could maybe just respond just a little bit about what's been said this morning here. So we know that through the topic selection process, which was done a fair time ago, that the people bringing the topics forward have a chance to bring forward witnesses who they want to see at that committee meeting. So I think this is the second or third time this may have happened, and I think if this letter was sent a week ago, I guess from a committee perspective, hopefully we can have a bit of an understanding that the motion at the last minute, I don't want to call it a stunt, but it's a bit of an issue, Chair, that I think for us as a committee, if the government side with its majority brought a witness in that wasn't on the topic selection and wanted to add them with our majority at that meeting, it sets a bad precedent, and I don't think the opposition across the table would think that's a good idea. So that was why we basically decided that, for the precedent's sake, that it was not a good idea at the time to do that. So, but we do withdraw the motion that I had sent around earlier.
So the motion was never actually moved. You're just not going to move it forward. There would have been an email sent out this morning. The PC Caucus had a motion onto it. You would have received it. So, MLA Regan.
So I do think we should respond to the NSGEU. I actually think it would be valuable for them to sort of understand sort of what happens when we're doing that, because I don't think we want them thinking that they were, you know, excluded, that there was anything nefarious. And in fact, I would actually take the PC motion, but just add that we take the last couple. I think that the previous agenda setting meeting, we could send a link to the April 11th, 2023 Hansard as well, so they can see, you know, just sort of what happens, and that it's not anything, you know, nefarious going on. We're just so they have a fulsome answer. So I would move that an explanation of the agenda setting process and a witness selection practice of the committee be included, as well as a link to the January 9th Hansard report and the April 11th, 2023 Hansard report, highlighting the motion relating to the topics that affected them, and that the chair write a letter with those elements involved.
Okay, we have a motion on the floor. Any debate? Okay, all in favor? Oh, MLA Palmer.
So I understand that the reason why our side withdrew the motion is because, I mean, we had a conversation basically right here with the NSGEU representatives here in the room, I mean, highlighting the reasons why we didn't think it was a good idea, or, you know, explaining the situation. We even explained the process of how topics were selected. So, you know, I'm not sure a letter at this point is really going to do anything except whatever, but.
Okay, so I didn't catch you, but I saw MLA White, so I'm going to let him first, and I'll come back to you if that works. MLA White.
I believe.
Oh, MLA White is actually letting me know that you were ahead of him. Thank you, MLA Regan.
MLA White. I just feel that we really need to put this on the record for NSGEU. They were here. I don't think they heard a fulsome explanation. I don't think they could see what happened. I just feel that it's important to make sure that they understand that there was no intent to exclude them. It was, and you know, we did have quite a cast of thousands here today. I just want them to understand that there's no ill intent, I guess is what I would say.
Any other discussion? Oh, sorry, MLA White. I apologize. You were being a gentleman.
It's a long morning already. This is a sore spot right now, because I do feel that it was brought forward in front of the meeting with them in the House, in the meeting here in front of us, to make us look bad and to put us on record of voting against it. But I honestly spoke on it, and I believe I said that it was a Liberal topic brought forward, and we supported all witnesses that were presented. not to start an argument, but I do feel like we gave him a fair explanation. I really do.
MLA Burrow, what's your point of order?
The motion has already been dispensed with. Discussion on the motion is out of order.
The motion hasn't been voted on yet.
And which is what MLA White is addressing. That motion was dispensed with at the time of the meeting's beginning, and further debate on it is not now in order, in my view.
So I'm going to talk to... So I'll be honest, it's interesting when we agree, but because MLA Regan used the same words that were into it for the motion forward, the Leisha's given advice that it's not out of order. However, it is now 11 p.m., which is the time of adjournment. So, oh, sorry, 11 a.m. It'll be 11 p.m. soon, I'm sure. So, the next meeting will be Tuesday 9th, 2024 from 1 to 3. If the House is still sitting, it'll be 9 a.m. to 11 a.m. The topic is withdrawal management services. Witnesses, Nova Scotia Health, Office of Addiction and Mental Health, Ally Centre of Cape Breton and Direction, 180. This meeting is adjourned.